A 46-year-old male with history of dilated cardiomyopathy from long-standing alcohol use disorder is admitted for a heart failure exacerbation. He is 30 pounds above his dry weight. On day 2 of his hospitalization, he tells you that he is worried about his liver and heard about something called a FibroScan, trademarked, and wants to get it as soon as possible. What do? Get the FibroScan. Now, since he's an inpatient, wait until after discharge to get the FibroScan. Talk to hepatology, then decide about a FibroScan. Or what is a FibroScan? Give you 10 seconds to think about this. Commit to an answer in your head. All right. The answer is wait until after discharge to get the FibroScan. I see excitement from other screens. Wonderful. So what the heck is elastography? We have to talk about this so you can understand what we're doing here. So it's a measurement taken after pulsations are applied to the liver. And the reason that answer is vague is because they're actually different types. You have magnetic resonance, shear wave, and transient. So clearly this is very complicated. FibroScan is transient liver elastography. I won't be talking about shear wave or MR, mostly because I have no idea what they are, and we don't use them here. So how do I interpret this result or a result? So the result ends up in kilopascals, which is a unit of pressure. So this is used to gauge the degree of liver stiffness, which theoretically correlates to degree of fibrosis. So the higher the pascals, the more stiffness, the more fibrosis the liver has. What we use is something called a METAVIR score. And this is actually a histopathologic scoring system that is then applied with the FibroScan results. So you have different kilopascal cutoffs depending on the cause of liver pathology. So you'll see F0 through F4, where F0 is no fibrosis and F4 is cirrhosis. So again, if it's fibrosis from cirrhosis, the kilopascal cutoffs are different from maybe autoimmune hepatitis. That is not the point of this talk, but understand there's a difference there. So how accurate are these test results? Well, anything that causes liver congestion will increase the stiffness and overestimate the result. So things like acute hepatitis, extrahepatic cholestasis, heart failure, which causes a congestive hepatopathy, food intake within 2 to 3 hours, the mechanism is not quite clear, and increased alcohol intake. And there are things that can make the reading difficult to acquire, which then make it hard to interpret. So if you have a patient who has a BMI greater than 30, getting the probe in the right place can be difficult, and ascites can make that acquisition of information difficult as well. So what do I do with the result? That's probably the question you're asking. And so you have to use it with lab tests and other non-invasive assessment of fibrosis risk factors and to look at the risk of advanced fibrosis or cirrhosis. So in other words, talk to hepatology at this point. Don't go rogue and try and do this on your own. But this is an important step in acquiring information about the patient's prognosis. So to put this all together, transient elastography of the liver. And remember, there's magnetic resonance and shear wave as well. Those are not talked about here. So it's an ultrasound-based assessment of liver stiffness. The results are in kilopascals, and it's used to monitor liver fibrosis. The METAVIR score is a histopathologic scoring system, but then is applied to the results of this elastography. And it goes anywhere from no fibrosis, which is F0, to cirrhosis, which is F4. It can be overestimated in acute hepatitis, extrahepatic cholestasis, heart failure, food intake, alcohol intake, and it's difficult to interpret in a BMI greater than 30 or ascites. Finally, the next step after you get this is to use lab evals, clinical assessment, and other assessment tools such as the FIB4 or APRI, which are not covered here, to determine the risk for advanced fibrosis or cirrhosis. And that's it.